Good afternoon, everyone. My name is Brooks Roach. I'm very pleased to welcome you here today as Manager of Patient Knowledge and Connection with Diabetes Canada. We have a really fantastic conversation in store for you, those of you who are tuning in today. And I'd like to begin by first acknowledging that I am joining this webinar from the traditional and unceded territory of the Mi'kmaq people in Epiquet. And wherever you're joining or watching from, I would invite you to express gratitude and recognition for the land on which we live and gather, and acknowledge the past inhabitants of the Indigenous lands we now call Canada. We are here today to have a discussion around reducing the risk of type 2 diabetes and workplace programs. So we're joined by two really fantastic guests that I'm super thrilled to have joining us. Dr. Diana Sherifali, diabetes researcher and associate professor at McMaster University School of Nursing. Welcome, Diana.
Thank you.
And Dr. Lorraine Lipscombe, director of the Novo Nordisk Network for Healthy Populations, physician and associate professor at the University of Toronto's Faculties of Medicine and Public Health. Welcome, Lorraine.
Thank you. Thanks for having me.
Well, thank you both for being here. Today, as mentioned, we'll be discussing workplace programs and the impact that these initiatives can have on type 2 diabetes prevention. Our two experts will be answering some key questions that they've been hearing in their own practice, in their own research, and also be hearing from you. So I invite you, those who are watching on Facebook Live, to please submit any questions that you've been curious about, and we'll do our best to make time for you to get an answer. So with that, please just, if you have a question, pop it in the comments section on Facebook. And without further ado, we'll dive right into this conversation. So first, I'd like to direct the question to Lorraine, and this is just to sort of set the stage. What is a diabetes prevention program? So what is it that we're talking about, and why should it be delivered in a workplace context?
Thank you, Brooks, and thank you everyone for joining us today. I think this is going to be a really exciting topic for us to discuss. So just to answer your question, Brooks, in principle, any health promotion program that involves physical activity, healthy eating, and even stress management and promotion of wellness can be considered a diabetes prevention program because of the clear benefit of these types of interventions on preventing type 2 diabetes. However, there's also a formal diabetes prevention program, or so-called DPP, that is more structured and was developed based on proven benefit in reducing the risk of developing type 2 diabetes. Now, this program, the DPP, specifically provides education and coaching on three components: physical activity, healthy eating, and weight management. And it is specifically geared to help people with pre-diabetes reduce their risk of developing type 2 diabetes. However, given that many people have risk factors for type 2 diabetes beyond those who have pre-diabetes, these programs can actually be helpful for a broad range of people. Now, just a word on risk factors. We know that there are several risk factors for type 2 diabetes, and while some of those risk factors are non-modifiable, such as age, coming from a high-risk ethnic group, or having a first-degree relative with the condition, DPP, diabetes prevention programs, can actually help address those modifiable risk factors, such as physical activity level, eating patterns, and body weight. So to answer your question about why the workplace, well, there are several advantages to considering these types of programs within the workplace. The first is because working adults spend most of their waking hours in the workplaces, this is actually an ideal setting to implement health and wellness programs because people are spending their time there. And this is becoming more and more important as jobs are becoming more sedentary. As we all know, especially now during the pandemic, we're spending a lot of time on screens, a lot of time sitting, a lot of times in desk jobs, and work days tend to be longer. Although they offer more flexibility, they tend to be longer, and people are finding they have less free time to engage in physical activity and prepare healthy meals during their non-working hours, and also to seek education and programs. And so because of this, the workplace is a place, might make sense because people are already there. Now, there are many benefits to health and wellness workplace programs. They may not only would they have the potential to improve the health of employees, but they can also have many other benefits, such as lower insurance and healthcare costs for the employers, greater employee satisfaction, loyalty and retention, higher productivity, and subsequently even improved presenteeism. Now, presenteeism is defined as a decrease in the lost productivity that occurs when employees are not fully functioning in their workplace because of illness, injury, or another condition. Now, just a word on, what are some of the different options for workplace programs focused on diabetes prevention. They can include many different things. They can include physical activity during work hours, such as group exercise, access to walking paths, walking meetings, and even exercise equipment in the workplace. But also can include healthy food choices, such as in vending machines, cafeterias, or catered events. And then finally, could also include diabetes education, awareness, and screening programs, and as well as even going as far as health coaching to help people make behavior changes. And when we're thinking about education and coaching, this can actually be offered through multiple different delivery modes. Could be in-person or virtual, could be real-time, or could be asynchronous through messages and resources, and could be one-on-one or even group settings. And finally, a coach can actually be anyone. Although traditionally health coaches have been healthcare professionals, recent evidence shows that a peer who is trained in coaching can actually be an effective coach for people in the workplace.
That's great. That final point, Lorraine, around harnessing the expertise of a peer, I think is really promising. And I think some folks might be thinking, well, this is all well and good, but I have been working from my spare room. And it's really possible, I think, to tap into those informal support networks, like something like that. And it's sort of the success begets success idea. If you start to really develop that momentum as a team, as a workplace, it doesn't have to be tied to a physical office space.
Exactly.
So Diana, a question for you is there evidence, and what evidence is there for diabetes prevention programs specifically in the workplace?
Right. Thanks, Brooks, for the question. And thanks, everyone, for joining us today. Indeed, there have been studies that have reviewed and summarized the research evidence to date. And there is promising evidence for weight loss and improved physical activity with less intensive and structured supports. So specifically, research shows that people who participate in such programs like the DPP improve their eating patterns. And this could look like changing their portion size or changing the quality of their foods, eating more vegetables, more whole grains, getting more physically active, moving more, which is important now more than ever. And that manifests in losing weight and in some instances improving their blood pressure and blood glucose or blood sugar levels. Unfortunately, the studies that we have come across to date have not been consistent in showing a decrease in the incidence of type 2 diabetes. And incidence can be looked at as the rate of new cases of type 2 diabetes that occur in that workplace setting over a period of time. However, this is more reflective of, the study methodology, the study approach, and not simply, the program or the people not doing what was intended to do with the diabetes prevention program, but rather just simply not following people long enough in time. So to that end, all in all, these changes, specifically weight loss and increased physical activity, can certainly have a considerable impact on lowering one's risk for type 2 diabetes. And as Lorraine mentioned earlier, diabetes prevention programs at work can have so many other positive impacts, such as building a sense of community, the formation of lunchtime walking groups and walking buddies. I think it's fair to say it normalizes health and wellness at work. No one needs to be a hero showing up feeling unwell or being the odd one out if they want to walk during lunch or walk during meetings. It also increases one's level of confidence and self-efficacy, the belief in themselves in attaining goals and changing their behaviors. So a lot of positive impacts.
Thank you, Diana. I think it's worth worth highlighting, as you said, a lot of the evidence out there is just bound by time, that a lot of these programs we haven't been running long enough to really say demonstrably that it's had a strong impact. But I think over time, naturally, we'd be able to observe that. So Diana, another question for you, and it's, Lorraine mentioned earlier this idea of both lost productivity or presenteeism and absenteeism. And I'm wondering if you can, on those two notes, illustrate some of the literal cost to employers of absenteeism and presenteeism because of employees with diabetes.
This is a great question. So yes, there is a cost to the employer and the overall economy. And this is typically referred to as the indirect costs of diabetes. So for example, Diabetes Canada estimates that the overall economy is impacted through absenteeism of those living with or caring for someone with diabetes. For example, in Ontario, every 4 out of 10 people that are touched by diabetes have missed work. And in an average year, those have missed approximately 1 week of work. So they've taken over 1 week away from work. So that all adds up pretty quickly. If we look at the US using the Center for Disease Control data, we know that indirect economic costs of diabetes may also include, as we've talked about, absenteeism, not being at work, reduced productivity at work, the inability to work due to diabetes-related disability, reduced productivity for those not in the labor workforce, and of course, lost productivity due to premature deaths. So the US projects this to be around $327 billion a year. It's quite daunting when you think of it that way. The positive piece here is that we know that we can do something. And as Lorraine mentioned earlier, evidence indicates that the diabetes prevention program and health and wellness programs of the like do in fact benefit employers. And this can be demonstrated by an increased employee satisfaction, increased loyalty, retention, higher productivity, and presenteeism. So it's not just a matter of showing up to work, but you're fully functioning and engaged at work. And this translates to lower insurance and healthcare costs as well.
Thank you. For employers, if they're sort of balancing the budget, if they're looking at getting down to nickels and dimes, when they see this as a budget line of, it will cost something to implement, what's the what are the tangible cost savings if they do bring in a program like this?
Right. Well, the potential cost savings are numerous, as outlined by the indirect costs that I mentioned earlier. However, a great way to think about the potential cost savings by employers is to understand what might be the value or that return on investment for the employer and what are they seeking. So the return on investment or cost savings may be an increase in presenteeism, increase in productivity and loyalty. To improve the potential cost savings, we also know that employers can be quite creative in how they implement or tailor the variations of the diabetes prevention program. As Lorraine mentioned earlier, this could be virtual or in person, could be group-based, could be individual sessions, could be a peer that's trained, a lay person, community health worker, or a champion in the workplace that's trained, versus bringing in a healthcare professional. So all of this may be tailored to better support employees and suit the employer ultimately.
Thank you. I really appreciate that point around tailoring to an individual need with the team as an organization, because there is, I think, some flexibility and capacity to be creative with these programs. And I appreciate what you said about measuring return on investment maybe a little differently. It's the same as this sort of idea in personal finance. Value doesn't necessarily mean how much money you're not spending. Could be right. Value could be all about convenience or quality. This could be return on investment. Could very well mean what's the mood in the workplace. What's the how many people have to miss work because of complications, et cetera.
Right.
Lorraine, I'm curious about the role of healthcare providers in this situation, like in the world of implementing these programs. Mm-hmm. So how could a healthcare provider help to encourage patients to participate in these programs and to participate in these healthy behavior programs that are offered in the workplace. Whether or not they know this is available, what suggestions can be made?
Excellent question. And as a healthcare provider myself, this is really relevant for me. I'm often having these discussions with my patients around, what sort of resources and opportunities and programs they have available to them out in the community. And so I think healthcare providers definitely play a central role in a person's health promotion. And they're often a trusted source of advice. People often look to their healthcare providers for, for how best to stay healthy and prevent disease. And so there are several ways in which healthcare providers could potentially, contribute to workplace diabetes prevention. So to start, they should always ask their patients about their workplace and whether there are health and wellness programs, what opportunities they have in the workplace to engage in physical activity, what kind of, food choices are available to them. They can also encourage their patients and empower them to advocate or help create such programs if they're not available, and particularly if their patients have, a manager or leadership position in the workplace, and they can actually provide them with specific guidance regarding potential interventions and ideas. Providers are also increasingly using something called social prescribing as a way to identify and connect patients to appropriate non-medical services and resources in their community. So using this approach, providers could actually prescribe specific diabetes prevention activities to patients that then they can then bring to their workplace and even adopt in the workplace. So an example of a social prescription that's being increasingly used is, an exercise prescription, or, saying, a prescription that says, walk 20 minutes, 5 days a week, right? But then there's also things like, go to the park, get fresh air for, at least 3 times a week, or, that kind of thing, making it very specific. And finally, healthcare providers can actually work directly with companies and organizations to provide guidance and support for workplace prevention programs. For instance, they can help design and evaluate programs with organizations. They can provide health education, screening, and even coaching for employees if there's capacity and a need for that. And then they can facilitate access to health and wellness resources. So lots of ways.
Yeah, thank you. I'm sure it can be a little bit daunting if someone's listening and their workplace doesn't have a program like this. They may be thinking to themselves, well, how could I start, or how could I promote something like this? And I think it's helpful to know that, generally speaking, you would absolutely have the support of a healthcare provider. And just to mention, you would certainly have the support of Diabetes Canada if you'd like to contact us and acquire more resources on the case for this. Be happy to help. On the note of what it looks like when a program like this succeeds, I'm wondering if each of you could share a success story of a workplace prevention program, either employee or employer driven, and what that's led to.
Mm-hmm. I can start. So in general, I've been really happy to hear that many major corporations are increasingly turning their minds to health for their employees and are increasingly recognizing the benefit of incorporating health and wellness, in their workplace. And one example I can think of was one promising program that was actually piloted and implemented in Canada a few years ago called Motive Action. Now, this program was specifically geared to increasing education, awareness, and prevention of type 2 diabetes. And so what they did was they started by offering diabetes screening through a questionnaire, followed by education and coaching and formal testing within the workplace of 11 Canadian companies, which actually spanned across the country and comprised of over 20,000 employees. Now, these employees were all given a questionnaire to fill out, which is called CanRisk. It's a validated questionnaire that's offered through both Diabetes Canada and the Public Health Agency of Canada to help people answer a few simple questions that gives them a score that estimates their risk of type 2 diabetes. And then, so after people filled out that questionnaire, employees who scored high on this questionnaire were then provided with blood testing for diabetes, as well as other metabolic measures, blood pressure and cholesterol. And they were all also offered 4 virtual telephone-based coaching and education sessions with a certified diabetes educator. Now, what was really striking to note was that almost 50% of the employees who completed this questionnaire were actually found to be at high risk of diabetes, so actually scored high on this questionnaire. So it just tells you that there are a lot of people out there who could potentially benefit from this type of program. Furthermore, a large number of those who went on to be tested for diabetes, almost 50% as well, actually ended up being diagnosed with diabetes and they didn't even know it. So employers should actually note that this kind of program can help actually identify diabetes at an earlier stage, which would help people live better with diabetes through earlier treatment and prevention of complications. Now, with this particular study, after 6 months, they did show some improvements in health measures, but a couple of things they noted. One is it was likely not long enough to see long-term benefit. It was only 6 months. And 2, they found that participation waned over the 6 months and people kind of dropped off. And so they kind of, surmise why might this be? One reason is that this was a centrally administered program and it was kind of top down. And studies have shown that you'll have better participation and retention within workplace programs if you actually involve a local champion in helping to develop the program. And so something that is locally grown, that actually feels like people can get behind it, and you have a local champion to maintain momentum and motivation. And the other thing is, although they provided people with coaching and education, they didn't actually include as part of that program workplace opportunities for physical activity and healthy food choices. And so that could be another component that would help have increased the success of this kind of program. But in general, I think this program actually highlights the importance, if nothing else, of raising awareness regarding diabetes as a first step in prevention, because it is likely that many of those people who had high diabetes risk score were not fully aware of this. And certainly the study showed that many people were diagnosed with diabetes that would have otherwise gone unknown until it was much more advanced. What about, I guess, Diana, do you have any examples?
Yes, so I've had the opportunity and privilege to work with a few different employers, medium to large size corporations, and we've crafted diabetes prevention-like programs in the workplace. So again, Lorraine, to your point about sort of the customization, grassroots up, and I was really impressed with the thoughtful approach by the employers. So they really had a good sense of what their employees needed, wanted, and the focus was always about health and wellness, not just disease and quote unquote disability. The term success begets success. I've heard Brooks say that earlier today. I was impressed with how that really snowballed into other behavior change, other ideas of health and wellness at the workplace. So one example was one employer set up a DPP-like program, prevention program. And following the success of that program, when people finished it, it spawned so many other employee-led initiatives like walking groups during and outside of the workplace setting, because there was a lovely walking track in like a forest nearby or some woods and that sort of thing. So people took advantage of what was available to them vis-a-vis through work, whether it was resources, the tools, the network kind of that outside built environment. So they really took advantage of that outside and beyond the workplace program. Another group really had a lot of fun with developing wellness habits at work. And, that's a term that we hear often now, behavior change to habits. And habits, like Lorraine talked about earlier, are really sort of small, tangible goals, quick wins. And again, the idea is that these wellness habits lead to growing more and more habits, and a quick habit may turn into a longer sustained habit. So some of the wellness habits that I thought were really quite kind of fun, you can imagine employees would set Outlook alarms in their Outlook calendars. So every hour there would be an alarm, and everyone in that office setting would stand up, do some arm circles. They would all do squats at the same time. And, people would modify it. And so they may start off with 5 squats, but, at the end of the month, they're up to 15 squats. And if you think, every hour you're standing up doing 5 squats, think about how many squats you've done by the end of that day. So it's kind of fun. Another wellness habit that people identified that was an easy, quick win was to fill up their water bottle while they're waiting for their computer to start. So it kind of gave people the incentive that, they had a vessel or a container of water. It would encourage them to drink more water during the day. And you always had, that kind of lull period where you're waiting for your computer to start up. Off you go, fill up your water bottle, and then you've started. So again, all of these small success stories, whether it's at the individual level, at the employee level, employer level, all of these wellness habits add up. Think about how that adds up each day, over a work week, over a month, over a year. It's truly incredible and inspiring to see where this goes. So yeah, it was really a lot of fun.
That's so cool. That's great.
I really appreciate that. And I actually, not to put you on the spot, Lorraine, but I know you had mentioned another program that was more international in scope. And I wonder if you could just speak quickly about that.
Oh, no, I'd be happy to. I wanted to make sure we had enough time. So as I was, Brooks mentioned, I had mentioned to him when we chatted earlier that I read about another really promising program that was actually developed and implemented in Israel. And what this program did is they trained middle managers across 13 government organizations to become health ambassadors in their own office. And these health ambassadors were then first trained, and then they were empowered to design a health promotion program within their workplace. And so that was their job. They were given some training in how, health promotion, given some tools, given some resources, but then everything else had to be sort of grassroots, had to work with their employees. And so it was really cool. So interventions, there was a whole host of interventions that came out of this. They ranged from cooking workshops, menu changes, nutrition lectures, physical activity classes, physical activity breaks, sports events for employees, stress reduction workshops, as well as health screening programs. I mean, this is just to name a few. And they then evaluated the maintenance, so how much these programs were sustainable over time. And then they also looked at some of the effectiveness on behavior changes. And they actually showed really variable success. But what they were able to tell us was, what were those key ingredients of success? What were the things that really led to high rates of behavior change, high rates of satisfaction, and high rates of maintenance and sustainability? And the most successful programs were ones that had a comprehensive approach. So didn't just do one thing, but did many different things. So it became almost like health was weaved into the fabric of the organization. It had to be like their new language, their new culture. It was a culture shift. The second thing was they actually organized a steering committee. So they actually brought employees together to create a committee and had everybody work on it together rather than just the manager. They made sure that they started with a needs assessment. So again, engaging the employees, finding out what they need, finding out where what they think would work and wouldn't, and being very flexible in the face of challenges. So don't, if something doesn't work, change it or stop it. And if somebody comes up with something new, then you should be considering that. So those were the ingredients of success. And, it's more about making sure that people can actually actually stick to things and actually engage in the program than the components of the program itself.
Sounds amazing.
Mm-hmm.
Yeah, it really does. I'm listening to these examples, and I'm sure the viewers feel the same, where it would be exciting to be in a workplace like that, to have that sort of culture around you. It's really enticing. So folks, I'd like to open the floor to a couple of questions that folks had submitted beforehand. And the first is just really around how to kickstart making the move to implement something like this. And this is predominantly from an employee's perspective. So Lorraine, you were talking about those sort of ingredients for success. And I wonder if you could just give almost some advice, either of you, on how to really pitch this and how to make that kickstart the engine on getting a program like this implemented in one's workplace.
Such a great question. And really that's the half the battle, is just getting started, right? It's just sort of figuring out, how do I get started? And I think there are so many things that an employee can do, regardless of what their role is at their workplace. I think the first thing is just, speaking with other employees and getting maybe a bit of a group together to provide greater strength in numbers. So, kind of, making sure that there's buy-in from your colleagues. Secondly, thinking about things that, making sure that if you are motivated to engage in such a program, or to even lead a program, that you would be willing to take on a leadership role, because oftentimes managers or employers maybe quite supportive, but they may not have the capacity or resources to do it themselves. So, if you are willing to kind of take on a bit of a leadership role, or do some of those initial pieces, I think that would also help. Thinking about looking at the Diabetes Canada website, there's some great information about, the kind of things that you might want to, that you could consider for workplace interventions. And you could maybe, pitch those to your peers, pitch those to your employer, and they don't have to cost a lot of money. Like Diana said, if it's even just things like, a break where you get up and do squats once an hour, that costs nothing, right? Walking meetings instead of meetings at your desk. Actually, I'm part of a research group. This reminds me, and everybody is virtual. We're always doing these Zoom meetings, and everybody is encouraged to do exercise during the meeting. So we've got people who are on like little stationary bikes. There are people who are just walking in place. There are people who are on a treadmill, others who are just, doing something with their arms, but everybody has to be exercising during the meeting. It's a little bit, dizzying at times, but I mean, it's at least it's a cultural thing. Like, it's accepted, and it's become part of, what health and wellness is becoming something that we promote. And I guess the last thing is, starting with those early things like I said, a needs assessment, putting together a bit of a committee, and then taking it from there, right? So I think that just getting started by talking to people and doing a bit of research around what potential opportunities there might be. I don't know if Diana, you have any other thoughts on that?
Yeah, just I think, for me, it just goes back to what's the value, and whether you're an employee, an employer, of a small business, a large corporation. I think at the end of the day, we're all human. We all have modifiable risk factors. We could all improve how we eat, what we eat, when we eat. Do we need to move more? So I think at the end of the day, if you kind of find that common ground, that common language of, hey, this is of value to me, would this be of value to you? And I think if you approach it that way too, I think the more, to Lorraine's point, the more people you bring to the table, the more strength you'll have. So good luck with that. Yeah.
Thank you, folks. Curious on this question is an interesting one, and it's, where do you see this crossing over with folks that are likely going to be working remotely or in a hybrid fashion for the long term? And to what degree do you think that this type of program could or should be amended to suit that reality?
That's a great idea. Go ahead, Diana.
Yeah, that's an interesting and really fascinating question. I think the hybrid approach is a little bit difficult to navigate because of the nature of virtual meetings. We're sitting, right? So to Lorraine's point, you have again sort of this new forum in how we work. So rather than work in an office setting where everyone could set an alarm in their calendars, everyone gets up at the same time, you don't have that synergistic relationship of everyone being in the same room, or Brooks and I being in the same office building, and at 11 o'clock we meet up in the foyer and then walk around the building 3 times. So I think that this new arena, this new forum, poses some challenges, but actually some really cool opportunities. So again, is there a way that you could set up something virtually where it's another Zoom link? Yes, it's another Zoom webinar, but people engage just to do virtual walking, a quick chat, sort of a wellness chat. It's not work related. You can get together and eat virtually. Maybe even though people are working remote, there's some opportunity to take pictures of where you've walked outside, that social prescribing. Hey, look, this is me at lunchtime. I'm walking outside. So it's really meshing together the hybridness, the virtualness, with what may be opportunities that traditionally were identified in a traditional workplace. The other thing that I just want to highlight is that working from home also presents so many other challenges in terms of ergonomics, close proximity to food, to screens, to you name it. So it's really about kind of starting from basics to say, what are my needs? And my needs may look different because of what my remote learning or working environment looks like versus, say, Brooks, who's in the office, versus Lorraine, who may have, young children at home, but is also juggling a full-time job. So I think that level of tailoring has to be further emphasized. So I know I've said a lot, but I think probably the biggest thing I could kind of finish off with is health at every level, whether it's a virtual meeting, downtime, what does your lunch break look like? Are you off screens? Health at every level, regardless of where you're working. Lorraine, do you have anything else to add?
I think you've everything you said, I agree with 100%. I think you've really given a lot of great advice for people who are working at home, and it is definitely challenging. Another point that I will bring up is I mentioned to you that first program, which was around and also we mentioned the formal diabetes prevention programs, and both of these kind of programs, they're really also, in addition to workplace interventions, they also provide that more formal coaching and education and diabetes screening. And that can be delivered very broadly. So if your employees are working from home, I think we lost Brooks. Okay, well, then let me continue.
Okay.
Anyway, as I was saying, so even if your employees are working from home, or like for Diabetes Canada, working across the country, there are, a lot of coaching programs and education programs are provided remotely and virtually, and they work very well. And we know now, since the pandemic, we've got all this video conferencing at our fingertips. So, so that can be another thing that could be provided virtually to employees, formal education programs, and using, for example, that Motive Action program where, all the employees take a screening test for diabetes, and anybody who screens high risk is then provided with a coach. And it doesn't have to be a healthcare professional. As I told you, there could be an employee who could be trained to provide this kind of coaching and education. And there's so much education out there, Diabetes Canada alone would have tons of resources on that. And so, there is also that kind of more formal opportunity that could be provided remotely to employees, who are all over the place.
Yeah, that's a great suggestion. And sorry, Brooks, if I could just add one more thing. I think companies are also very aware of, the stress and toll that looks like we've lost Brooks again. The stress and toll that some of the virtualization of work has taken. So in some instances, again, I don't know if this has been sort of a grassroots effort, top down, or sort of a synergistic decision, but some companies have set aside, say a Friday afternoon of every month as, a Fuel Up Friday, where people take that afternoon for mental health and wellness, get outside, fuel up with something that nourishes you, literally, spiritually, emotionally. So sometimes that health and wellness is a little bit beyond diabetes. It's indirectly related to diabetes, but absolutely in that realm of health and wellness for sure.
Yeah, no. And actually, it got me thinking, like, if companies are really committed to health and wellness, particularly because of the data that you presented, that this would, the return on investment is potentially very favorable. Having that, for example, Friday afternoon, even to have, sports events, have cooking classes, kind of things, education sessions, so that people aren't having to access them on their own time, right?
Absolutely. Yeah.
And it gets everybody kind of together. And so at least, no matter how busy people are in their life at home, they've got that opportunity at work at least once a week, where they're getting some health and wellness support, getting up and moving, right?
It's nice to know that someone cares. I think that's at the end of the day, someone cares. Yeah.
Yeah. And it boosts morale and collegiality. There's so many things that, can come out of having those, those opportunities, as they say, team building, right? But this is more than team building. This is also great for people's individual health.
Absolutely.
Brooks, are you okay?
Yes, thank you. I for anyone watching who saw me pop in and out, the wonders of working from home, as just discussed, had a bit of technical difficulty, but I'm back, and what I heard was excellent. Again, that idea of these programs are a great tool for morale, for workplace environment, and for everyone's collective and individual health. So it's a win-win-win-win-win, continue ad infinitum. So we're going to wrap the question and answer period there. But I'd like to say thank you for those really thoughtful and interesting and actionable answers, and great questions as well. So before we wrap up, I'd just like to remind everyone who's watching of Diabetes Canada's ongoing work and advocacy in this space. So I'm very proud, in our own organization, taking on our own corporate policies, like a lack of sugar-sweetened beverages at work events and conferences, and an employee assistance program, and trying to sort of walk the talk, so to speak. And it's also an ongoing advocacy position. So advocating for the support of health initiatives in the workplace all across Canada, and through initiatives like this, and through the recent policy statement, which you can see in this video description and posted in the Facebook comments. So again, on the note of, if you're looking for resources or materials to take to the workplace and to advocate for the implementation of a program like this, it's a really great guide and really outlines a lot of the points that have been raised tonight so eloquently. So want you to know, who are watching, this is a real priority, and it's, as we've talked about, there's a ton of benefits to these programs, and it's really important to keep pushing for their implementation. So for those who have more questions, who want to learn more, you can visit diabetes.ca or Diabetes Canada on social media. If you want specific direction, or if you have a question that doesn't really fit within a broader category that's more attuned to your own health, you can get in touch with us at 1-800-BANTING or at info@diabetes.ca. So feel free to get in touch. And you can also, what you'll see in the video description and the comments is a link to the Canadian Diabetes Prevention Program. So a real tangible example of one of these programs in action. Before we wrap up, I'd just like to say a sincere thank you to both our guests. I really appreciate this conversation despite getting booted out by Zoom for a moment. And I'd like to just give you both the opportunity for any final remarks. So maybe over to Diana.
Well, thank you everyone for your time. It's such a privilege to talk about diabetes. Thank you, Brooks, for organizing, and our expert IT person at the back end, Matthew, and to my co-presenter, Dr. Lorraine Lipscombe. I always learn something new from her every single time. It's just such a pleasure to volunteer, participate, engage with Diabetes Canada. And again, I'm always so grateful for their advocacy, their education as a diabetes educator as well, and also for all of their support in research and ongoing advocacy. So thank you, everyone.
Thank you, Diana. I just will echo your comments. Thank you so much for this opportunity, and thank you also to my colleague Diana Sherifali. She's just such a pleasure, and I also learned so much from you too. And thank you to Diabetes Canada for bringing diabetes prevention at the forefront. I know that you do so much advocacy for people living with diabetes, but we can't forget that we are dealing with, unfortunately, a big increase in diabetes cases with type 2 diabetes. And we know that a lot of type 2 diabetes can be preventable. And so I really appreciate Diabetes Canada's commitment to shining a light on this and making an effort to improve the health of Canadians and actually prevent diabetes. So thank you very much. And thank you, Brooks, for hosting a great webinar, and to Matthew for your technical support. And thank you to everyone for joining today.
Yeah. Well, on that note, that's the perfect conclusion. I'll just add that our two guests, I've greatly appreciated getting to connect with you both and learn from you today, and long before and surely long after. So thank you for all you do as well. To those watching, thank you for tuning in. And again, please feel free to get in touch if we can be of any support at Diabetes Canada. So with that, thank you very much and take care, everyone.
Bye-bye.
Bye.